Everyone, I'm just going to go through the Chapter 38 PowerPoint, which is assisting with the general physical exam. A general physical exam is typically done for a couple different purposes. It is either as a yearly physical, well exam to confirm overall state of health and provide a baseline for vital signs and measurements, or it's to diagnose a medical problem, like if a patient comes into the office sick or not feeling well. The clinical diagnosis is an initial diagnosis from the physician based on the patient's signs and symptoms. Remember to focus on understanding the difference between signs and symptoms. Signs are those objective things that can be seen, felt, measured. Symptoms are typically subjective information, which is just information that the patient supplies you. After forming the clinical diagnosis, the physician may then order testing or imaging studies to determine the actual diagnosis based on those objective findings. This is done to confirm the medical diagnosis or to rule out other diagnoses. A differential diagnosis is determine the correct diagnosis when two or more diagnoses are possible. A good example of that would be if a patient comes in with a sore throat, they could do a throat culture to determine, is this just, some tonsillitis with like a, infection there, strep throat, or is it just some, inflammation in the throat from some nasal drainage? There's no infection there. It's just going to be treat the symptoms. A prognosis is a forecast of the possible course and outcome of the disorder and the prospects of recovery. The role of the medical assistant in this procedure is going to be assist the licensed practitioner and the patient. We will conduct the preliminary interview and start thinking about those good critical thinking questions. We will determine the chief complaint, which remember is that, one or two words up to a sentence of why the patient's being seen in the office. We will start asking them their history of present illness, which is more information about why they're in that day. That would include all the information that you obtained asking those critical thinking questions. You'll also do their vital signs. You will document their medical and surgical history and the medications they're currently taking, as well as over-the-counter medications or supplements they're taking. You will also assist during the exam with instruments and supplies. You may also position the patient and get them into a gown. You want to ensure the patient is physically and emotionally comfortable and help with positioning, maintaining privacy. You want to communicate with the patient about the process and what is going to be happening each step of the exam. And then you want to observe for signs of distress or if they are uncomfortable with something. Some safety precautions, you want to make sure you're using hand washing, like we've talked about, your PPE, and then make sure you do some education to the patient about respiratory hygiene, as in cough into your elbow, not onto your hand. Discard biohazardous waste properly, and then you'll be cleaning and disinfecting the room and equipment. Some emotional preparation for the patient. You want to explain to the patient exactly what's going to happen during the exam. Use simple, direct language. You can offer a chaperone if the person would feel more comfortable or the patient would feel more comfortable. You can offer for the patient to use the restroom prior. You can assist with a gown or just giving instructions of how to put the gown on. Some people are confused, does it open in the back, does it open in the front? And just giving them those instructions will make them feel a little bit more comfortable. You really want to make sure you're using proper body mechanics to prevent injuries while lifting, moving, positioning the patients. There are some different positions, and I will tell you that is extremely important. That is pretty much what Chapter 38 you'll be tested on, is knowing the positions of the patient. And so we'll go through each one of these. This is the picture of all the different positions that you will need to know and will be tested on. On the test, you will also be asked to provide two things that can be examined, whether it's, like in the sitting position, you could have the chest and the head, or the heart and the neck. So you're going to provide two things that can be examined in the position based on the position. So sitting, obviously that's just sitting at the edge of the bed. It can be sitting in a chair. The physician can evaluate the patient's head, neck, heart, chest, back, and arms. Sitting might not work for somebody who has difficulty maintaining the sitting position, especially if they're sitting like on a bed rather than something with a back support. Also, if a person has a hip injury or hip issue, sitting might not be the most comfortable. Supine is also known as recumbent. The patient's just simply laying on their back with their arms next to them, legs flat down. This position, the physician can examine the head, neck, chest, heart, abdomen, arms, and legs. Anywhere you can see on the patient right now, they could examine. Might be difficult for a patient who becomes short of breath easily or are in late stage pregnancy. The next one is dorsal recumbent, which is where the patient lays back, their knees are bent, and their feet are flat on the table. The physician can examine the patient's head, neck, chest, heart in this position. This may be difficult for a patient with leg disabilities or immobility. Lithotomy is the next position that's typically used during the examination of female genitalia. The patient will lay on her back, the knees bent, feet up in stirrups, and they will scoot their bottom down to the edge of the bed. Many women are uncomfortable in this position, so you really want to minimize the amount of time that a patient is in this position. For each of these positions, I don't ask about who it may be difficult for. That's just as an FYI, but you definitely want to know the name of the position based on the picture. You should be able to match that up, and you should be able to give me a couple different areas of the body that can be examined in that position. The next one is Fowler's, where the patient lays flat on the bed and their head is elevated. You can have semi-Fowler's or Fowler's, and that's just based on the angle in which they are laying. The position is best for patients with shortness of breath or back injuries. It'd be the most comfortable for them. The prone position is laying face down. Their head can be turned to the side, and the arms can either be over the head or at their side. It'd be good for an examination of the patient's back, feet, or some of the musculoskeletal system. It is not possible for patients who are in late stage pregnancy to lay in this position. Some patients who are obese may also have difficulty with this, or people who have difficulty with breathing, shortness of breath, respiratory conditions. Sims is the next position. This is where the patient lays on their left side with their left leg slightly bent, and the left arm is placed behind the back. And then the right knee is bent and raised toward their chest, and the right arm is bent and up near the head for support. The position is used for rectal exams, anal exams, perineal exams, and we'll talk more when we get to the digestive system about why a person is placed on that left side, especially for GI exams. The patients with certain joint deformities of the hips or knees may be unable to use this position, so you have to be careful with them. The next one is either knee to elbow or knee to chest position. And typically that's kind of like the patient is on their knees on the bed, and their thighs should be at about a 90-degree angle. It's used for anal or perineal exams, some proctologic procedures. It may be difficult for pregnant, obese, or elderly patients. And then just FYI, a fenestrated drape is a drape or a paper towel, like a towel with a special opening or a hole in the center of it, which can be used to examine certain areas and then keep the rest of the area surrounding it covered up. Proctologic, this picture always kind of makes me laugh because the bed typically does not bend in a V form like that. Typically, proctologic is just where a patient is bent 90 degrees, so they could be standing on the floor and bend at a 90-degree angle at the waist and lay their chest on the bed. It's just a 90-degree angle. It's often used in prostate exams, rectal exams, that type of position and exam. This one is not in your book, but I did want to kind of give you a picture of this and kind of what it is. Oftentimes for Trendelenburg, that's what this is called, a patient's laid flat on their back and then their feet are raised higher than their head. It's good for patients who have low blood pressure or hypovolemic shock, which is loss of blood. This is the only picture I could find of it. It's kind of an odd picture, but you can kind of see what this looks like. When we're doing exams with patients, you want to make sure that you're considering their culture, which is a pattern of assumptions, beliefs, or practices, because it can shape the way people think and act. It can also shape or determine how they will treat themselves if they have a medical condition, who they will allow to treat them and their communication that they will have. You want to avoid stereotyping or judging. And patients with physical difficulties may require some extra assistance, either getting onto the table, getting a gown on, positioning, that type of thing. So just be aware of that, that might be something you need to help with. When the physician is doing the actual physical exam, there's different exam methods, and they should be done in a particular order. So inspection is the visual exam of the patient's entire body. So that's where the doctor takes their eyes, or you take your eyes and look at the patient. Okay, we're looking for abnormal rashes on the skin. We're looking at their hygiene. You as a medical assistant can help this method of exam by making sure there's good lighting and making sure the patient's body is properly exposed or draped, like having the patient into a gown. The next exam method is auscultation, which is the process of listening. We can listen to heart sounds, lung sounds, abdominal sounds. We can listen for good blood flow, and we use our stethoscope for that. The next method is palpation, which is a type of touch, and it's used to feel texture, temperature, shape, and the presence of movement. A doctor can feel superficially where they're just touching the surface of the skin, or they may palpate and kind of push deeper to feel organs or internal structures. Percussion is a tapping or striking of the body to hear sounds or feel vibrations. It's used to determine the size, location, or density of a body structure or organ underneath the skin. You may have seen a doctor put their hand on your belly and then kind of tap on top of their hand. That would be something called indirect percussion, where they place the hand over top and then strike their hand with the finger. Direct percussion would be directly tapping with one or two fingers right on the skin or body. Measuration is the process of measuring, which you could measure the height, weight, size. Typically, you need a tape measure or a ruler for this. And then manipulation is this moving of a patient's body parts, and it can be used to check range of motion and to see how well a joint is working. Some components of the general physical exam, you can kind of take a peek through this. I'm not going to read through all of this, but you can take a look at their general appearance to see if they're in good health. You can take a look at their head and neck, their ears. I will let you read through these just because it's some ideas of what you might look at. This is not the focus of what the test will be on this chapter. It's going to be the positioning and the exam methods, and your role as a medical assistant in the physical exam. You can take a look at the patient's nose and sinuses. You can look at their mouth and throat, their chest and lungs. Key term here, kyphosis, which is a deformity of the spine characterized by a bent over position. It's also known as humpback. We'll take a look at the patient's heart, their breasts, the abdomen. In the abdomen, we will kind of section off the abdomen into quadrants, which is 4 equal sections of the abdomen, which can be the upper and the lower, and then you would be right or left. So right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. We will talk more about that in chapter 21 when we get to the organization of the body. They'll also do an examination of the genitalia, whether it's male or female. Rectal exam, a musculoskeletal exam, checking the muscles. A note here, scoliosis is a lateral, meaning to the side, curvature of the spine. They might do a neurologic exam to check reflexes. This table is a nice table to look at because it does tell you the component of the exam as well as the materials or the supplies that you would need in order to perform that exam. These are pictures of instruments you may use. A is your color vision test. It's called the Ishihara color vision or color screening test. B is the ophthalmoscope, which looks into the eye. C is the otoscope, which looks into the ear. D is the tongue depressor. E is a Snellen vision chart, which will check your near and distance vision. F is a pen light. G is a speculum, which is used in vaginal exams. And then you have I, which looks like some lubricant. H, which is your gloves. And then J, which is your stethoscope. This one here is actually a nasal speculum. They can use it to look up the nose. And when you squeeze the handles together, it opens up the nasal passageway. After the exam, the physician may order additional testing. You may provide some patient education, and they'll schedule potentially a follow-up visit or recommendations for follow-up. And that is it. If you have any questions, please feel free to let me know. Otherwise, make sure you focus on the patient's positioning, the examination methods. Those are extremely important, and make sure you know or can list some areas that you can examine in each of those positions.